Greetings, everyone. I would like to thank the organizers for giving me an opportunity to talk about our tools on hepatitis C elimination. So, as you know that the World Health Organization has set a goal to eliminate hepatitis C by 2030, and one of the targets is to diagnose 90% of the Hep C population. Therefore, the first step for us is to identify a cost-effective testing strategy. Unfortunately, one-size-fits-all approach does not work for Hep C testing because the prevalence can vary by jurisdictions. Also, differences in population characteristics and opportunities to engage in care can substantially vary from one place to another. Finally, the differences in budget and resources between different settings can also influence which Hep C testing pathway is used to detect cases. So as the cost of treatment has come down, the cost of screening now is the largest driver of Hep C elimination plan in most countries. Therefore, we should tailor the diagnostic strategies to each situation. And we should use a systematic and structured approach that is backed by organizations like the WHO to identify cost-effective diagnostic pathways. A few years back, we launched Hep C Calculator, an online tool in collaboration with the World Health Organization that evaluated the cost effectiveness of Hep C treatments. In most countries, we find that treatment is cost saving. And today we are launching a new addition to this tool, which is focusing on Hep C testing. The tool estimates the cost effectiveness of different testing pathways for a given country. The methodology is similar to what we had used in the past. There's a microsimulation model that simulates the natural history of disease for a given country based upon the epidemiology. Users can then look at the results for different pathway settings. Here is a screenshot of the tool. As a first step, users select a country, the population characteristics like number of people, the viremic rate, the target screening rate, the cost of DAAs, etc. And then users can select different testing pathways. They can create their own pathways, such as what is the first step for screening, what test is used for confirmation, is it, and what's the location, does the patient travel, or is the testing done on site? Then what kind of liver staging is there? Is it on site or patient needs to travel? What is the cost of travel or on site testing, etc.? And then also it ends with, finally, how do we assess SVR at the end of the treatment? There's also an option of selecting default pathway options, and this is a screenshot shows that 5 different pathway options that have been embedded for a given country. So after selecting the pathways, the results can tell us what is the total cost that includes cost of testing, the treatment, and sequelae if Hep C is not treated for each pathway. We can look at the quality adjusted life years for a given pathway, the incremental cost effectiveness ratio, which tells us if the testing pathway is cost effective or cost saving, percentage of viremic patients diagnosed, the diagnostic cost per patient treated, and how many patients were treated eventually. For each pathway, we can also look at the clinical outcomes at a population level. For example, the figures below show per 10,000 people how many cases of decompensated cirrhosis will happen under no screening and for other pathways. And also the outcomes like hepatocellular carcinoma and liver-related deaths. So in this case, in this example, we found that pathway 1 is the most optimal pathway because it is the cost saving. It results in the maximum quality adjusted life years and also saves cost compared with other screening strategies. The existing tool does not allow us to inform if Hep C elimination is feasible and what would be the budget. Like questions like how many people need to be screened to reach the elimination target, how many patients need to be diagnosed and treated, which testing strategy should we use for a given setting, how much would it cost to eliminate Hep C. To inform some of these questions, we are developing a new tool called Hepatitis C Elimination Tool in collaboration with the Task Force for Global Health and Coalition for Global Hepatitis Elimination. So this tool will be informing questions like the feasibility and budget for different countries. So in this case, in summary, we are today launching a new publicly available online tool that can assist in making decisions on Hep C testing strategies in different settings. So this tool can inform the project managers and policymakers to make informed decisions that improve outcomes and also identify strategies that are either cost effective or cost saving. We are planning to add more countries in the tool to inform testing strategies. Please reach out to our collaborator Sonil Shilton at FIND. I'd like to acknowledge the support from FIND and National Science Foundation, my collaborators from FIND, Mass General Hospital, and CHIPMER. With that, I would like to thank you all for your attention.